While the president and Congress struggle with lowering the cost of health care, many Americans are finding that the solution can be as close as their local pharmacy or even supermarket.
Stick your tongue out and say, ah.
6-year-old Samantha Malloy woke up with an earache and a fever.
102.8. You are a sick kiddo.
Her mom, Kelly, thinks it might be an ear infection.
It takes a little while to get an appointment at our doctor's office. And if she was running such a high fever, I wanted to have someone take a look at her right away.
Which is why she decided to come here. Not to the emergency room, but to her neighborhood pharmacy. For $62, this walk-in clinic in Manassas, Virginia treats common illnesses like sinus infections, coughs, and sore throats. A bargain considering each year Americans spend an average of $283 at the doctor's office and $445 at the ER, not to mention the time spent in the waiting room.
We see a variety of people with insurance or without insurance. I think it's getting more and more busy because it's such a convenient place to come and very inexpensive and very efficient for people.
Come on in. Samantha and her mom were seen as soon as they arrived.
People are tired of waiting. They're really looking for easy access, affordability, high quality, and in a way, when it's consumer driven, they believe they should be able to have all of these.
This is also called an upper respiratory infection.
Turns out Samantha's ears were fine, but she did have a contagious virus. And while the nurses here can write prescriptions, Samantha is just ordered to drink lots of water and get plenty of rest.
We're good to go.
Our medical correspondent, Dr. Jennifer Ashton, is here with more on these low-cost retail health clinics. Good morning again.
Good morning, Maggie.
Could you trust the diagnosis? I think I'd be freaking out saying, did they get it right?
Well, you know, the buyer has to be aware and the patient has to use the same amount of caution as if looking for a doctor. The fact of the matter is these healthcare clinics are staffed usually by LPNs or licensed nurse practitioners who are very knowledgeable. True, they don't have the same degree of education and training as an MD, but for the basic and minor ailments that people are going to these clinics to have treated or evaluated, they are usually very safe and very effective and a good use of money.
What kind of services do they provide?
So basically they would evaluate and treat minor ailments, anything from an ear infection, a throat infection, or urinary tract infection, something that doesn't involve a high degree of complexity or medical risk. And again, it's much less expensive for these pharmacies to employ a nurse practitioner than a doctor.
Since they don't have your medical history, what should you as a patient bring with you?
Very important, Maggie. If you're going to go to one of these clinics, you want to know your medical history. You want to make that person aware of what your medical problems are. You want to know all of the medications you're on and bring that list to the clinic. You want to actually get a phone number for someone you can contact in case the symptoms worsen or you become sicker. And lastly, you do want to follow up with your normal healthcare provider if you have one and let him or her know that you've been seen at one of these clinics in case they need to do further testing.
Is it just cash or do they take insurance?
It started out as purely a cash-based retail operation, and now they've become so popular that most of them are accepting insurance. And again, I think the potential is that will alleviate some of the emergency room overflow, and we're going to be seeing more and more of these. Potentially, it's a very good use of healthcare resources.
All right, Dr. Jennifer Ashton, thank you.
You bet, Maggie.